Well, South Africa leads in HIV prevention among the homosexual community. Delegates attending the International AIDS Conference currently taking place in Melbourne have been urged to sign a declaration that all sexual minority groups should be afforded the same access to HIV treatment and care that is provided to all infected. Now, joining me now on the line via Skype is Dr. Andrew Tucker. He's an MSM research analyst at Anova Health Institute, who's also attending this meeting. Morning to you, Dr. Tucker. Obviously, you've done a lot of research in South Africa with homosexual groups. What have your findings been?
Thank you very much. Our findings have been primarily the particular structural factors, and this is particularly my research within the organisation, that particular structural factors or social factors such as homophobia are very strongly associated with a harm to the ability of men who have sex with men in being able to protect themselves from HIV and also to be able to engage in what we call health-seeking behaviour, for example, to access clinics and to access competent medical care.
Are homosexuals being dealt with differently, do you think?
I think that in societies generally you find that men who have sex with men, which includes individuals who identify as homosexual, can face particular social stigmas in life, which can be viewed as particular barriers to their ability to lead lives the way that they want to.
Now, you're attending this big conference. What are the main areas of discussion so far?
Well, just to correct you, though, I'm not actually attending the conference. Some of my colleagues are attending the conference. I'm in Cape Town. But I think that one of the big things that we're seeing from this conference is a far greater appreciation and awareness on the part of world experts that particular social and structural factors are now key to address if we're going to make a sustained difference to HIV prevalence around the world. Up until now, a great deal of research has been focused on the individual level. It's been focused on seeing how individuals can act in more sensible or more health beneficial ways. And what we're seeing now is a focus on factors outside of the individual, factors at the community scale or the wider social scale that also need to be taken into consideration. And that's the kind of stuff that Anova Health and Health for Men are particularly focused on. For example, in a community way, we have particular programs aimed at, say, peri-urban township locations, where we try and engage with factors like homophobia and challenge homophobia from a health perspective. But also, I think very much as well, we're seeing a far greater drive, and this is something that Anova is directly involved in trying to make sure that clinic spaces, that the medical environment in which men who have sex with men might go to seek medical care is competent and is non-discriminatory.
Now, excuse my ignorance, what does an MSM research specialist do?
An MSM research specialist is involved in lots of different research projects across the country, looking at ways of making health services and making the healthcare available to men who have sex with men better. And also, I mean, originally my focus was very much looking at, say, social cultural factors that affected different groups of men who have sex with men across the country. So out of that, I've had a far greater focus now on particular health issues, which are, obviously necessarily important if we're going to challenge HIV.
Now, Dr. Tucker, my next question is twofold. I mean, how far have we actually come with antiretroviral science and its effect on people? And, how far have we come in terms of rollout?
I think that, I'm not an expert when it comes to rollout, but I think that we have come a long way with ARV research. I think that it's definitely going to be one of the things that we'll keep hearing about in the future. I think, however, it's also important to recognise that all the focus on HIV work, it's split into two particular groups. That's biomedical research, which is things like ARVs and other potential drug treatments that can be used. But it's also, I think, very important to recognise it's about HIV preventative social factors, and it's about seeing these two things in tandem. It won't necessarily be the case that we'll finally put an end to HIV by just dealing with biomedical or just dealing with social and culture, but it will be a combination of the two.
Now, you've done a lot of work, obviously, on the homosexual industry, the homosexuals in the townships in South Africa. Is this a common trend worldwide, do you think?
Is what a common trend?
The way that, obviously, the stigma, as you mentioned, around homosexuals, especially in South Africa, is this a common trend worldwide?
I think that you generally see various barriers to men who have sex with men being able to lead open and full lives around the world. I think that what we see in South Africa and also in various other African countries as well, because it's important to realize that this isn't just a South African phenomenon, are factors, I think, accentuated by, say, histories of discrimination, histories of racial discrimination, which are also somewhat different. It's worth bearing in mind as well, I think, that the work that Health for Men is now doing is trying to explore and engage with how factors that we've discovered are relevant for men who have sex with men in South Africa are translatable into other African contexts. And we're doing a lot of work now, say, training healthcare workers in places like Tanzania and Uganda and Kenya.
Well, Dr. Andrew Tucker, MSM Research Specialist at Anova Health, appreciate your time this morning. Obviously chatting about that big AIDS conference which is underway in Melbourne, and just getting some ideas as to what might come out of that. We do know that a minute's silence was held during that conference as well for some of those HIV activists who were on that plane, that MH17 flight. Dr. Andrew Tucker there chatting to us from Cape Town.